informative and educative edition of the program brought Way to Health, an hour-long program brought to you by the Ministry of Health, of course designed to educate, inform, and empower you about health-related matters. Today is Tuesday, the 19th of May, 2026, and my name is Angeline Noan, driving you through this edition of the program. So today's edition of this program is heavily loaded as we have gathered important topics, two different topics, of course, but we are discussing them together. So I don't want you to get confused, but just listen carefully. You will get the different points that we will be driving at. So this morning we have invited in the studio because we don't have much time to go around back and forth. We've invited in studio the Family Health Unit represented here by Dr. Tame Keyekesa, obstetrician gynecologist, and also Deputy Director of the Family Health Unit at the Ministry of Health. She's also here with Mrs. Fasi P. Johnson, Senior Midwife. I like that title. And also Maternal Health Coordinator at the Family Health Unit as well. And we are also here with the Non-Communicable Diseases and Injuries Unit at the Ministry of Health, also represented here by Mr. Gontopo. I guess that's the sound of it. Mr. Gontopo Nuan, Hypertension and Diabetes Coordinator at the Non-Communicable Diseases and Injuries Unit, and Dr. Philip Z. Ireland. He is, of course, representing the John F. Kennedy Medical Center. And the both of them are here to talk about hypertension. As you are aware, the 7th of May marked World Hypertension Day. So we are here. It's better late than never. So we are here this morning to provide the necessary education on hypertension. And then from the family health angle, we are also here to talk about safe mothers and the futures, like combating postpartum hemorrhage in Liberia. We will take a very short break to be right back with details. Stay tuned.
Our help, our life is nice to make it better. That's what we do. Our help, our life is nice.
Welcome back and thanks for rejoining us. To kickstart our discussion, we will go around the table and hear from our guests, beginning with Mr. Noah. Good morning.
Good
You
morning.
can pull the mic closer if possible.
All right. Good morning, and good morning to everyone who is listening. Like she introduced me, I'm Gontoko Omido Noan,
Okay.
and I diabetes and hypertension coordinator at the Ministry of Health, Non-Communicable Diseases and Injury Unit. So we've come here today to provide more information regarding the World Hypertension Day celebration. We are observing this day across the country.
Mhm.
And World Hypertension Day is actually a global day.
Okay, thank you.
Mhm.
Let's hear from you, Mr. Ireland. Dr. Ireland, look at me. Good morning. How are you doing?
Good morning, ma'am, and good morning to Liberians everywhere.
It's your first time. We are honored to have you here.
Thank you for having me, and thank to the Ministry of Health and ELBC 9949 and all the panelists and hosts. Thank you very much for having me. I'm very privileged to be among such great people.
Okay, before we move to our next guest, Dr. Ireland, apart from being the head of medicines at JFK, the next for the other position that you have, I want you to talk a little about it.
Okay, I am also an endocrinologist.
Yes, I know something
Okay.
like that
So
exists.
we take care of diabetes people with thyroid problems, adrenal gland problems, pituitary gland problems, anything that has to do with hormones. And hormones affect your life very seriously. So that's the work that we do at JFK also. Thank you very much, ma'am.
Okay, back to you.
Good morning, Angel. Good morning, everyone in studio and of course in Radio Land. And yes, We are glad to tag along with the non-communicable disease unit today to talk importantly about postpartum hemorrhage. To be here, of course, as program or the Ministry of Health Family Health Unit, the issue of maternal mortality is one thing we have put our boots on the ground for. And you remember shortly ago, we had launched 365 days of action to end preventable maternal mortality and newborn mortality. And of course, the postpartum hemorrhage counts number one when it comes to maternal and maternal death. The Ministry of Health, in collaboration with partners, has launched a complete new intervention that is evidence based and valid. That's the WHO postpartum hemorrhage peer bundle, where we are implementing the emotive bundle of care.
Oh, okay.
And that is very reason why we're here. But we are glad to tag along hypertensive disorder because this is one of the risk factors that puts women and mother at risk for bleeding.
We
Thank
will
you.
certainly talk about the 365 days intervention that was recently launched by the Ministry of Health. I was excited when I heard that. Family health was, of course, tapping with the non-communicable diseases because the implementation is going on. It's not important that we keep the public informed about the progress we are making when it comes to this intervention. So let's hear from you, Mrs. Johnson. Good morning.
Okay. Good morning, Angel. Good morning, everyone.
Go
Okay.
ahead.
Good morning, everyone, and good morning to everyone in Radio Land. Once again, my name is Mrs. Fancy P. Johnson. I work at the Ministry of Health, Family Health Division as a maternal health coordinator. And like others have said, we are here today to jointly provide those basic information surrounding safe motherhood. We are going to be talking about safe motherhood, saving the future of Liberia. We want to end preventable maternal death with the emotive bundle approach. This bundle is an intervention or an innovation that was developed by WHO, and Liberia had key into it because currently, as we look at our statistics, maternal death in Liberia, PPH is the first cause, is the leading cause of maternal death within Liberia. So we are going to be discussing in depth to see how best with the 365 days implementation ongoing, how best we'll be able to tackle this issue and how well we'll be able to prioritize any those preventable causes or any those conditions that want to lead our mother to lose their life or to losing their life. Thank you.
Okay, thank you. All of you are welcome. So, word hypertension, I want us to start with hypertension. Word hypertension, I just want to read this portion of this word hypertension thing before we get into the actual condition. So, word hypertension day 2026 was observed May 17 with the theme Controlling Hypertension Together. World Hypertension Day is a global health awareness initiative established by the World Health Hypertension League in 2005 to educate the public about the risks of high blood pressure and promote proactive monitoring and management. The day highlights the importance of accurate blood pressure measurement, lifestyle modification, and early detection to prevent serious complications such as heart attacks, strokes, kidney disease, and vision loss. I just wanted to read that portion of it because every other health out this is about raising awareness and reminding the people again about what this condition is so that we cannot forget. And we are always here talking about these different health holidays. But to begin with this whole hypertension thing, I just want us to tell our listener what hypertension actually is. The word hypertension in the simplest form. Dr. Ireland, let's begin with
But let me try that. Okay. High blood pressure is, we call it high blood pressure and we call it hypertension. But so everybody out there can understand it, I will give some examples.
Okay.
When your tire flat, you can pump air inside so it can reach to a certain level, right? If you pump it too much, what happens to it? It will burst, right? If you're playing basketball or football or soccer and the ball gets soft, you want to pump air inside. A certain amount of air you're supposed to pump in it. If you pump it over plus, what will happen? It will burst, right?
Mm-hmm.
So we have blood vessels in our body, and it's supposed to have a certain pressure to carry the blood around to serve you so that you can live the way I'm living now, I'm talking to you, right?
Yes.
Now, there are certain things when you affect that blood, those blood vessels with pressure, like when you vex plenty, we talk about the risk factors later on, or when you drink alcohol plenty, your blood pressure just can start going up. You go wash the dishes, you go wash the dishes. I told you about this to draw the water, and you didn't do it. Why have you coming late? When you start talking like that, okay, you're angry, or there are other risk factors that we talk about. Your blood pressure starts to go up, and if it passes a certain threshold, that's the time you start getting a complication for high blood pressure. So high blood pressure is when the blood pressure is above what it's supposed to be for a long period of time.
Okay.
Okay, and we can test it by using those machines that they put on your arm, and the blood pressure machine. That's how we check it.
Okay, so you talk more about the high blood pressure aspect of it. What about when it is very low? Is it an issue also?
Oh yes, it's an issue. We call that low blood pressure. So it
Okay.
has to be to a certain range. Okay, low blood pressure can go into shock, and it can go into other bad things. Okay, so it's not good to have low blood pressure or
Yeah.
high blood pressure. It just should be just right.
Why is it called the silent killer?
It's called a silent killer, and that's a very, very important thing because we see it at the hospital level all of the time. You don't have any symptoms. There's nothing happened to you. Your blood pressure can be high. Like sometimes the older blood pressure will be high. She know because there's no headache, no fever, no diarrhea, nothing. And when she's blasting at the children to wash the dishes, all of a sudden she goes to the ground. She has a stroke. She didn't know she had high blood pressure. Okay, so that's what we call it the silent killer. When a killer comes in, the silent killer assassin, nobody knows that guy. He sneaks into the country, he walks around, he interacts, he talks with you until he kills the person he comes to kill. So that's what we call it the silent killer. High blood pressure, you will not know him until he kills.
Okay. So talking about this condition, let me hear from Mr. Young as
Yeah.
well. Talking about this condition, can we also help our people understand how much attention they need to give to it based on the prevalence rate in Liberia?
All right. So in Liberia, we have a data collection system that all the health facilities around the country report to that system. And then for 2025, out of 900 plus health facilities in the country, 12 health facilities reported 10,054 people who were diagnosed of hypertension. And that actually shows that if all the 900 plus health facilities were to report, we're going to get huge number. So because of that, Ministry of Health, NCD division, and partners are embarking on this campaign to ensure that people are aware, people are able to reach out to the health facility to do their checkup so that early detection will yield to early better result. Yeah.
Okay, so does
So,
that
mhm.
go ahead.
Yeah, so we have the global scenario about 1.4 billion people. They are also affected of this disease. So it is not just unique to Liberia. It is a global issue.
Okay, that I get. So the explanation you just gave us, does
Mhm.
that mean that there are more people being affected by this condition at the level of Liberia?
Yes, like I was giving the background. Like if we are carrying on this awareness or screening and people are seeking health care, we will be able to get more normal. So since we are not reached out to everyone or we are not getting all the data from all the health facilities, it is also alarming because from just 12 health facilities and we are getting this number, it means huge population of this country is affected with this condition. Yeah. Mhm.
Let's hear from you, Dr. Ireland. You are more in the clinical setting and dealing with this condition on a regular basis. Have you, by any means, observed why people are coming down with this condition? Like behavior or lifestyles What is it that's contributing to to this condition?
Okay, so they got two kinds of high blood pressure. One we call it essential high blood pressure. That's the one when we're growing older, okay, our blood pressure starts to go up, especially those who don't take care of their health. There are many what we call risk factors. And some of them include, for example, Liberia, eating plenty white rice and getting fat. So when you're getting fat, we call it obesity, your blood pressure goes up. Eating too much salt, okay, it helps the blood pressure to go up. Drinking plenty alcohol, okay, especially one time you say that you want to drink the whole club beer factory, your blood pressure goes up very high, okay. Also, there are other things too, like for example, if you have diabetes, okay, sugar sickness, then eating too much processed food. Let me tell you, Liberian people about this one. It's very important. This supermarket business, processed foods, everything you want to go to the supermarket, you want to be quick, you want to be quote unquote civilized. That's not a measure of civilization. Going to supermarket. That's the place where you get some of the worst foods in the whole world: sugary food, processed food, fast food, pizza people, hamburger people, and pizza people, and this white rice. Okay, all of these things, kidney disease, okay, and endocrine disorders we talked about earlier. All of these things are risk factors. Another thing, some people don't like to sleep. Chronic sleep disorder. When you like to sleep, you worry. You want to know the password and all things that are post sleep. Okay. And financial business, when no money, when you broke, your pressure just can go up naturally. Okay. So for all the broke people, calm down. Find work to do because your blood pressure will start going up.
So, what is the best way to manage this condition? We will talk about the symptoms to give people pointers at what point they should rush to the hospital and all that. I think we should talk about the symptoms before we go to the management of it because they say if you worry too much, if you do this, you might likely come down with this condition. What should I do instead? If this thing is happening, what should I do to replace it and all that? But let's deal with the symptoms at first.
Okay, so we said from the beginning it's a silent killer. You don't know the symptoms. But at JFK, we collect data, like the chief was just talking just now. We collect data and I carry a report every month. What I see, if Liberia see it with me, they will call for a national emergency immediately. Okay. Most of the reason why the graves in Monrovia and the surrounding are filled is because of stroke. The number one killer to JFK, that's stroke. And for if you see one stroke patient at JFK, it means that 300 other people that have stroke in the community that people don't know about. It's a silent killer. So they usually come to the hospital, and the symptom that we see will be, the complication you see that will be stroke, heart failure. Dr. Barkley, Dr. Kekula, Dr. Awal, and all the cardiologists at JFK, their whole ward is filled with heart failure patients. Okay, so you can't breathe, your feet swelling, your stomach getting big, okay, we call it ascites, and you can't breathe. You walk from here to the place, you're breathing heavily. So if you're out there right now, if you walk from here to your gate, you're breathing heavily, come to the hospital quick because it may probably a high blood pressure affecting the heart. So they have many other symptoms, but when you start getting symptoms now, it's almost too late. You have complications already. Okay. So the best thing to do is to test your blood pressure regularly.
That part. Mr. Noy, you want to add it?
Yeah, so like that said, hypertension most often it does not present symptoms from the onset, but when it becomes severe, where some of your organs in your body is being affected, then you start seeing the symptoms all around, like severe headache. People will be complaining, I'm having headache, and blood vision, you are not seeing clearly. Anything you see, you're looking 2 or 3 in your eyes. So it becomes alarming. Then sometimes you will be having numbness in your extremity, your fingers or your legs. So those are the signs. If you are seeing those signs, it means there have been some alteration on your internal organs, like kidneys, like your heart and other things, and it's being affected. So, like we said, you need to be checking regularly to be able to see what is happening, so that you'll be able to prevent.
So when Dr. Ireland, when Dr. Ireland was explaining, you outlined some of the ways to prevent. I heard a few things that is, more like this is how you prevent this condition. But do you have more ways that people can prevent this condition? Then we can, take a pause and go to the hemorrhage thing.
Okay. So, for example, if you have to go to the market, you have the market right here. The market is right here. Don't take pen pen. Don't take keke. Walk, walk to go a mile to the market because a sedentary lifestyle, when you lazy, it can make you fat and it can carry your blood pressure up. So exercise. To the executive mansion, you have to take the stairs. Okay, to the parliament building, you have to take the stairs.
When you say elevator.
Okay, yes. So JFK, Dr. Ikinba say, take the stairs. So we start taking the stairs. Okay, and when you take the stairs, and here to LBS, take the stairs. When you take the stairs, that exercise. So don't get in car to go everywhere. Don't get in a motorbike. Another thing is the food. You have to go to our country rice. Country rice are correct food, and eat from God to man. The good food to the market, the bitter balls, the kitchen, the fresh fish. That's what you eat. Okay, you leave this white rice and the Western diet is the most horrible diet in the whole world. In all our medical textbooks, we say this is one of the risk factors for death. This is one of the risk factors for high blood pressure, diabetes, and what have you. Too much sugar, too much salt. One other thing I have to talk about is stress. Okay, the password business. Okay, and the false politics. Take life easily. Say prayers, walk. Meditate. Some people can do yoga business. Say prayers. I'm not talking about that fire for fire prayer. I'm going to care about it in the name of Jesus. I'm not talking about that. I'm talking about, things that will calm your mind down. Watch funny movies. Watch, talk with people, spend time with people in a positive way. Okay. In that way, you bring your stress levels down and the high blood pressure comes down. One of the things I do, sometimes I go to the beach just to look at the ocean. And it just brings my whole stress levels down. Okay. Find your way to bring your stress levels down.
Identify something
Yes.
that can bring your stress level
Yes.
down.
Yes.
Don't just sit in a room there worrying over there.
Yeah. Don't do that one. Don't do that one.
Okay. Mr. Noah, you want to add it before we move to the hemorrhage thing?
Yeah, so there are so many ways, like that said, I is a specialist to that area. So it is also good, like we talked about prevention, if you will be able to reduce your weight. If you notice that you are getting too heavy, you should be able to do something that will reduce your weight. It does not mean you should go in the gym and be lifting heavy irons up or walk. Yes, and be able to do physical work like gardening. Like our unit, we actually working with support groups, people who are living with diabetes and hypertension. So we make them to do gardening, to be able to eat fresh fruit from God to man, like Ireland said. And then doing that physical work, doing the gardening is also part of exercise.
Okay.
Yeah, so those are things that we encourage people to do. Then you sitting all day long, and like some people whose children are staying with them, they send the children go do this, and the day sitting down, they don't want to move. At the end of the day, you will see yourself healthy and very big, then it becomes problem. Yeah, so reducing your weight.
Okay, thank you. Thank you very much. As if you're listening, you just join us. You're listening to Roadway to Health. I'm here this morning with the Family Health Unit and the Non-Communicable Diseases and Injuries Unit collaborating here this morning. So we are discussing two different topics. We just talked a little about hypertension. So we are moving to postpartum hemorrhage. That we'll be talking more about maternal health and all those things. They are linked, right? So that I can say. What exactly is this postpartum hemorrhage?
Okay, thank you, Angel, and thank you to the hypertensive.
So that the early can just pull the mic close to you, just have
Thank
a little bit.
Thank you.
Okay.
Thank you so much. And this postpartum hemorrhage, in simple English, it is the abnormal bleeding after childbirth. A woman put to birth, if she delivers a baby, the excessive blood that follow that baby is what we're talking about. And as we know, the blood carry lives. So if the woman is bleeding that blood out of her body, she's bleeding her life out. And if it's not arrested in time, it kills very fast. We're talking about If you don't identify, diagnose it, or treat it in about 15 minutes, 1 hour, it's too long. The woman can die.
Okay. That's a serious one.
Yeah.
So, let's localize it. I think that is the general perspective of this whole postpartum hemorrhage. But in Liberia, what does the condition look like? What does it look like?
So in Liberia, it is a very serious issue. Like if we talk about what causes it or what puts women at risk, because normally every woman that put to birth they will bleed some blood is a normal thing. But when it becomes too much, when it becomes too much, and then it puts the woman at risk of dying. All right, like Dr. Ireland said, the risk factors include even the high blood pressure we're talking about. And in Liberia, most of our mothers are already younger people who can develop high blood pressure in their pregnancy. So having high blood pressure in your pregnancy can put you at risk of having heavy bleeding when you deliver your baby. You can also have issue with the afterbirth. We call it the placenta. When a woman delivers and that placenta, the load that comes after the baby fails to come, it can cause the woman to bleed more than the normal blood she should bleed. Beyond that, if a woman, because the womb is like a balloon, it's like a ball, and when the baby sits in it, it stretch it, it opens it wide. And then after that baby leaves that womb, the womb should be able to come back together and squeeze itself like a little hard ball. And at times, when the baby comes out, the womb fails to come back together. We call it atoning. Because when the womb comes back together, it squeezes all the blood vessels that was supplying that baby with food, with oxygen and everything. It is able to close all those loopholes.
Okay.
Unfortunately, if it fails to close or come back together, we call it contract, then the woman will bleed excessively. Again, lastly, there are people who have breaks of bleeding. There are chemicals in our body that are responsible to hold you from bleeding. Some people, you cut small razor blade, cut them, they will bleed a lot of blood. But other people, the moment something cut them, before you look, some kind of thick blood just sit down there, it close. So the things that are responsible for that we call clotting factors, they are able to hold bleeding in some people. Those who don't have that, when they deliver, the blood not able to clot, so it will bleed more. So those are the different risks that can put the woman at risk of bleeding.
Okay, but I still want to ask about the risk factors and causes. I know they are compound one way or the other.
Yeah,
Some are thank you soon.
yeah.
Okay, Mrs. Johnson, let's hear from you. When it comes to the risk factors or some common causes of this bleeding in women after childbirth.
Okay. Like she has already given few of them.
Mm.
Another thing could be sometimes when the woman go to give birth, she will tear. Sometimes the place the baby passing, when the area tear, the vagina or the womb or any other place, it will cause the woman to also bleed. Or like that already explained, sometimes if the placenta, the afterbirth is what we call placenta. That afterbirth, it got different things attached to it, small lining, different things. If piece of it remain, any of that memory, a small it remain in the womb, it will cause the woman to also bleed. And women who are given birth plenty time, you now born 10 times, 8 times, they are also high risk. Because like she explained, the womb, the more you stretch it, the more it gets weaker. Every time the woman giving birth, she having a lot of children, it also expose her to bleeding after birth. So because of that, sometimes when she gave birth, for that womb to get high immediately after birth, it will not happen. Sometimes it will take some time and you need to do other things to be able to help her. And then when the woman gets in pain again, she's not supposed to stay long in labor. Woman get in pain, the way she can set time, and woman supposed to stay in pain for. In her first time giving birth, at least she go for 12 hours. If she had given birth for some time, at least 8 hours. But the woman get in pain for 8 hours, 2 days, 3 days, they keep it on, no landing, they put all the baby laying her, and when it's still on there, it can also expose her for bleeding. So when a woman gets in labor, she should go immediately to the health facility where they will be able to check her. We got something we call pathograph. They will use it to monitor her labor. If she's not able to deliver to maybe the clinic, they will send her to the hospital. Then the way we got JFK and other places, because we got two ways we need to deliver. It's either you born it by yourself or doctors come in and do operation on you. So when woman stay long in P2 is not a good thing for her. And woman deliver all the afterbirth placenta, all the things after the baby that are giving her baby nutrient need to come outside so the womb can get her and come together to stop that bleeding. But if those things don't happen, our womb may also bleed. So to prevent some of those things, what we can tell them to go for ANC checkup, BBL checkup.
Exactly.
Yes. When you go for BBL checkup, they will know whether you now born plenty, you high risk smaller, or they will know whether you're too small to born a baby, or they will know whether your pressure high, because when your pressure high too, like the doctor was explaining, it also affects your whole body system. Because that wound there is receiving blood supply from the heart while the baby there to feed the baby. So when you deliver that wound to get high, that pressure too, if they treat it, it can also affect the baby, and sometimes the baby may even die.
So that brings us to this part. I want us to talk about it a little bit and give key advices in that direction. Then we're on the issue of being going to a very skilled midwife to deliver is very important. So let's talk about the issue of people doing home delivery and all these things. Let's talk about that part.
Yes. Oh, home delivery is very risky. Giving birth at home, almost like the scenario that I was just talking about, the hypertension, almost like you just giving yourself up. Because childbirth is a natural thing, but it has a lot of risk associated with it. And when you give birth in the community, sometimes you don't know how that birth will end. That woman may give birth, the baby come out, but other things need to happen so the body can come back together. You give birth in the community to a TTN or to a black pepper, they don't know what to do. When a woman gave birth immediately after delivery, what we can do, we have something that people will call active management or test the latter. When a woman deliver, we can give her medicine, we give her injection to help that wound to get high so that the afterbirth can come up. But in the community, TTN will not have that injection to give you.
Exactly.
If a woman gave birth in the community, sometimes if they were rushing, someone can press on the woman's stomach to push the baby up. And I told you another thing that can cause being a tear. When they do that woman tear, they will not able to suture that, to sew that place to stop that woman from bleeding. If a woman gave birth in the community, so that the afterbirth will not come up. These doctors and other midwives, they are trained to go in to be able to get that afterbirth out. But people will not know that skill to get it out. Lot of things. So giving birth in the community is a big problem. It's not good for any woman. We are not encouraging women to give birth in the community. When you are pregnant, go for your BBL checkup and go to the clinic to deliver or to the hospital. Because in case of anything, they will be able to treat you their own time. Sometimes say you deliver, you lost some blood. She told you about the people while the blood can come together. People that get a clotting problem. Some people when they deliver, their blood loose. The blood will just be coming in. And now they are fought in understanding this. So those kind of people, you give them medicine to be able to control that bleeding. But those people in the community, nobody have medicine in that to give. Before they reach down, they already going into shock. Then they say, oh, the woman fit. Oh, they giving milk, they giving it will be the milk can solve that problem. And that time that woman need other medicine, she need injections, and then she even need blood to come back to herself.
Okay, so Dr. Yeke, let me get to you. She mentioned going to the hospital regularly for ANC testing. Let's also tell our pregnant women listening how many times they need to go to the hospital during pregnancy. And you can also combine that with the WHOE motive bundle approach linked to, the
Oh,
postpartum hemorrhage.
okay. Thank you so much, Inja. Thank you, Fasi, for especially talking about why you should go to the hospital and forget about this home delivery. Coming to the hospital, or even before we talk about the number of time the pregnant woman should come to the hospital, just just by knowing that pregnancy is a journey that should be planned. No woman should just get pregnant because, oh, I don't know how it happened. And most of us in Liberia will say, we know how it happened. Fine. You know how it happened. We're not blaming you. You listening to me, be better out there, expecting mothers out there. When you get pregnant, we won't know how it happened. Mistake, play, come to the hospital. When you come to the hospital, we have the opportunity to do what we call risk assessment. And the risk assessment is where we put you in colors. We put you in color coding, meaning your kind of condition tells us the category you belong in. If you are high risk, if you are moderate, or you have a normal pregnancy. When we should talk about the number of times you should come to the hospital, at least the WHO have said every pregnant woman visit the hospital 8 times. Visit the hospital 8 times. And your first visit should be within the first 3 months of your pregnancy. You know why? We will determine whether the pregnancy is in the womb. We will determine whether you have born before. We will determine whether your firstborn bleeding happened, plenty bleeding happened. We will determine whether you have operation for your first baby you born. We will also determine whether in your family you someone that can have high blood pressure or someone in your family have high blood pressure. We will determine whether the new pregnancy husband or father is the same father as the old person. Because there are a lot of different things we call the risk assessment period we can pick up and tell how we plan your pregnancy journey with you. Now, when we do that, it gives us the opportunity to prepare early, to know how we will plan you. When she was talking about some of the things that cause bleeding, very big baby alone is a risk factor. You got a big baby, the young people, when they first morphine, they get good appetite, they will just eat. We can weigh you in your visit. We know how much weight you gaining. We can tell you reduce it. We know how the baby growing, how much weight the baby getting, and all of that. But even if we're not able to control the weight until the baby is too big for you, we say no. In your case, we'll deliver you by operation. We plan that early, and you don't even have to wait to get in labor. The WHO bundle of care is the approach that was designed to say at pregnancy, we can determine how much blood level you have. Because anemia is one of the high risks, those with low blood. When some people get pregnant, they get appetite. That fufu and soup every day.
That part.
That dry red, I only let that Benesi scent. Or I only let, the fried fish, or the meat pepper soup in a wheelbarrow, which has nothing to give you. So when we know that you have anemia, we treat the anemia. We check your blood level. We give you food, list of food that you should be eating. Okay? That's for prevention in a bundle of care. Now, if you come to delivery, we have the emotive bundle. Emotive means capital M, capital O, capital T, capital IV, and capital E. This means that we should detect the bleeding early. Before the WHO bundle, the emotive bundle, woman with doctor, Mayweather, anybody, we just use to look at, they have more blood, plenty of blood, how much blood, and you see how they best so that they okay, they have more, I think she get PPH. We were just thinking. But this new innovation that was developed, they got something to calculate the amount of blood you've lost.
Okay.
That tells us that yes, you have clear diagnosis of PPH. And once we diagnose it, we activate the treatment.
Okay.
Then we'll give you massage. The aim for massage. We rub that ball. The ball is a womb now. We rub it and make sure it responds to us to get hot.
Okay.
We will give you oxytocin. Oxytocin for O is the one that will help your womb to come together. That injection and some of it are even medicine we call mesoprostol. We put it under your tongue. We put it under in front of you, or even in the rectum. We can use it at that stage. Then we give you IV fluids. Because you lost in blood, we got to expand your blood volume to be able to carry oxygen to the brain. If it doesn't go there in 15 minutes, you go.
And we don't want that.
And we don't want that.
Exactly.
If you don't get blood coming back to your heart overpump. Hey, before you know, you overwork, you weak. How many know it? When you overwork, you delay that blood. Okay? So before we get to that stage, we don't want the heart to overwork. We give you something they call IV fluid. The last thing we can do, we can give you something to stop the bleeding. Those who get bleeding problem, they call it tranexamic acid. That's the T in that E motive. It helps to stop the bleeding. Then lastly, as a team, all these things we're doing it in 15 minutes at most to examine you to see whether we corrected the bleeding, or if we haven't, we can send you to the next level of care.
Okay. Oh, wow. This topic is very, very, very interesting. And I wish we had all the time, Dr. Ireland, I wish we had all the time to talk more about that. I was saying this thing when it comes to this maternal health thing is a whole thing by itself. Hypertension, a lot, and they are all important topics. But I want us to take few calls so we can hear from our listeners. That part is important too. We don't have much time. We can take few calls. We will conclude with the 365 days intervention. But if our pregnant women are listening, I don't want to say. So if you just join us, you are listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. We are in talk this morning with the Family Health Unit represented here by Dr. Yekesa, Mrs. Johnson, Dr. Ireland, Mr. Noah. We are talking hypertension and postpartum hemorrhage, two different topics. But if you're listening and you want to contribute, ask questions, you can call us on 077 376 088 are the numbers to call. You put in your calls quickly because we don't have time. So let's take this first person. Good morning.
Hey, good morning, madam. How are you?
I'm fine. Your name, where do you join us from?
Oh, my name is Jeffrey from the Postpartum.
Let's hear you quickly.
Okay, thank you very much for the important and for the health. You know, health just like the Bible, where it's all the double edge.
Oh.
Let me ask the specific question you want. Okay, I wanted to know, speaking of, what are the causes of high blood pressure and low blood pressure? And B to A, between high blood pressure and low blood pressure, which one is dangerous? The last one, what can be the prevention for both of the high blood pressure and low blood pressure? Because it's signal that all over in Nigeria.
Okay. Good morning. Oh, we lost this person. 077 376 088 are the numbers to call. Good morning.
Good morning.
Your name and where do you join us from? Okay, let's hear you quickly. Okay, thank you very much. Good morning.
Good morning.
Your name and where do you join us from?
I want to find out how many hours of normal men should sleep at night because my brain has a computer right and I only sleep for 3.5 to 3 hours at night. And as athletic, you talk about the breathing, sometimes you do the walking and doing your breathing fast. I mean, how can you tell between a normal a patient and a normal breathing? I mean,
okay, thank you. Okay. Yeah, I want our be better net to call to me. I'm taking calls, though we don't have time because I want to hear be better or be man calling. Good morning.
Good morning.
Your name, where do you join us from?
I'm Felix too, calling from Greenfield County.
Let's hear you quickly.
Yeah, I have a question to my police in studio.
Please be fast. We don't have time.
Yeah, this field is 65 days or something that the Ministry of Health put in place for maternal and neonatal care. What are they doing to work with the diagnostic unit within the various counties? Therefore, Eastern, I heard them talking about hemorrhage and all of these things.
Okay.
And most of the lab in the Republic of Nigeria, there are a lot of CBC
Oh, okay.
things.
Okay, please, we don't have time. Your question came across. Please, they'll respond to you. Okay?
Thank you.
Okay. So we can't take any more calls. I mean, the calls are many, but we have to stop here. My apologies. I hope you listen to the messages and you took them in because we don't have much time. But before we go back to our guests, to respond to the caller's concern, I just want us to do something quick. So there is this information. I'm saying the Truth Breakfast Show, and this is the update. The Truth Breakfast Show posted doctors at JFK Hospital protesting for salaries. We inside that kind of thing. And then I'm also seeing your call relatives at JFK to know if they are fine according to our sources. And up to the time of this point, there is no medical doctors on duty. Seriously? So I just want to call the head of communications at JFK to quickly speak to this issue before, that Yeke said that Ireland, before we respond to the callers what's happening, you're busy. You will have to give us more time to be. So let's call the head of communications at JFK. I'm calling right now.
Well, I can give some answers to that right now.
Oh, you can give some answers to that. Yeah,
Yes.
Please put a match to him.
Because I was on call with my team last night, saving lives, saving a lot of different people. All my people were on call last night, and they worked all the way to this morning, just before morning report. Doctors in the internal medicine department and other departments are at work right now. There's no protest that I know of.
Okay. Let me also put him on the line. Good morning.
Good morning, Roger. Good morning to the Liberian people. Thanks for allowing us to provide this clarity. We want to inform the public that there is no go-slow action here at the GFK Medical Centers. Our doctors are fully on duties and they are executing and taking care of the patients. So we ask the public to remain calm. This is a misleading information. In any case of such, we are appealing against unnecessary panic because this is something that is going to affect our healthcare system. You can play politics with anything, but avoid playing politics with the healthcare system.
All right. Thank you very much. I think the message has gone across that it's no go slow at JFK. What people coming from with this kind of information? I see that the irony had been working on like they say go slow. What's up now? Yeah, so that Kesa, the questions, most of them came from hypertension. So let's begin to respond to the caller's concern.
Okay, so for the caller from local county, high blood pressure or low blood pressure are both bad things. We don't want them. We want your pressure to be good. Some of the things you can do to prevent high blood pressure: eat healthy, which means eat from God to man. Eat the vegetables and the fruits from the marketplace. Exercise, like the chief said, the Honorable Noah, he says, you can go in the gym if you have that time, but just use the stairs to your office, walk to the market, and walk with your partner, and you de-stress by praying, by doing yoga, or whatsoever that you find good breathing exercises. Learn to de-stress. Don't get in conversations that will make you angry or agitated. Try your best. And make peace with all men. That's one of the ways to break the pressure all the way down.
Mm-hmm.
Okay. And then for those who take their blood pressure medicine, those who are already hypertensive, there's something going around in Liberia. I want you to listen to this very carefully. Once you diagnose of high blood pressure and you're taking the medicine, don't stop taking your medicine. I don't care that evangelist, that woman behind the house that can put water and oil on you and say, in the name of Jesus, everything gone, your sickness gone. Continue to take your medicine. You tell her, say, Jesus said the sick person need doctor. So continue to take the medicine. Don't stop it. In Jesus' name.
Amen.
Yeah. Yeah. So in relation to,
So, I'm sorry, Dr. Ireland.
Yes, ma'am.
Is that your parting comment? Just give us your parting comment, because before we go across the table, we are already out of time.
Okay, since we're out of time, I want to thank all the panelists, the hosts, the Ministry of Health at ELBC 99.9 FM. It was a pleasure to be here. High blood pressure is real. It's a silent killer. Check your blood pressure often. Be at peace with everybody. Forgive. Walk the stairs. Take exercises. Eat healthy fruits and vegetables, and your blood pressure will remain in the right place. Thank you very
Thank
much.
you, Mr. Nguyen. Yes.
yeah. So thank you very much. So like the caller was calling from FOIA about translating the messages into into dialects. We've already done that, and it's been aired all around the country from the unit. And then we also currently carry on screening all around the country for that hypertension and diabetes. So to commemorate this day, hypertension day. So we encourage people to check your pressure to know where your status is, so that you'll be able to take whatever prevention you can take. So thank you, and please let's keep safe.
Yes, thank you. I benefited from that training yesterday. But like I said, you can speak to the 365-day intervention in some way the time.
So for the 365 days, definitely is a movement full of actions. It's not a new thing. We just taking meaningful actions every day. And every day counts, and every action counts to ensure that no mother or newborn die from preventable causes. And of course, postpartum hemorrhage as the leading cause of death is key in this process. The diagnostic system is very much important in this count, and we've been working together with the unit to ensure that you have the reagents at the facilities, and you have what it takes the professionals to be able to not just check the level of blood, but correctly type and cross-match them. And of course, to make sure that the bloods are available, safe bloods are available to the people. We are working with blood safety unit to run county level blood drives that will ensure that people are voluntarily donating blood from the right people. So close, I just appreciate you for hosting us here again. And of course, let's take this serious, because the community will depend on you to send your wives, your mothers, your sisters, your aunts to the hospital on time, so that we can do all we can to save their lives together. Because a woman is a network of a community. If she is safe, the future of Liberia remains safe.
Thank you. Mrs. Johnson, very quickly.
Okay,
please.
thank you so much. Thank you, Angel. Thank you to the Liberian people for listening to us today. I just want again everyone out there to know that bleeding after childbirth is a danger sign in pregnancy. And we don't want anyone to keep a woman home in the community to give birth. Let all of the pregnant women come to the hospital for ANC checkup at least 8 times, and come also to deliver at the hospital. So to conclude, I say thank you for giving us the time, and we look forward to seeing all our big baby coming to the hospital to deliver. Thank you.
I'm a force too.
Hallelujah.
I'll be better. You go to the hospital. I'm key on this. I always say this. On to be serious, I'm always saying this. Your AMC visit is very important. There are things that can be checked that you will not be able to check home.
Sure.
So always go to the hospital. So many thanks to our guests for sharing such valuable insight this morning. I know I'm out of time. I have been here this morning, your host Angeline Noah. Until next Tuesday, have yourself a good day, and I hope you took all the messages in. Thank you.